is in there right over your tummy. Your elbows in tight. Yeah, go to the doorway. My pleasure.
Jerome, I'm Laura. I'm going to be taking care of you here in the recovery room, okay? How are you feeling?
I am a little sore.
A little sore? Well, that's to be expected.
Yeah.
Are those tears of joy?
How you doing, Jerome? How's it going, man? It's okay, man. You in pain? What's on your mind?
Joys of happiness.
Joys of happiness. Well, you know, I'm glad we could all help you out, Jerome. It's all over that. And I think things turned out really nicely, too.
Really?
Yeah. I'm excited for you, thank God. You just sit back and relax, and we'll take good care of you here. Laura's a real expert.
Fine.
Yeah. Okay. We're right here with you, Jerome.
Thank you so very much. Thank you.
You're so appreciative, man. I love that. Wish all of our patients were like Jerome.
That's great.
We're done with Jerome, and actually he did very, very well. He's awake from anesthesia now, awake talking, and pain-free, he tells us, and everything went well. I was, quite pleased with things. So we're on to the second case.
So, sit up and swing your legs over the side of the bed here. Just sit on the edge. Let's see how you feel. But don't get off the bed.
Yes.
How are you feeling?
Very good.
Go. It's kind of low, so beware.
Okay.
How's that feel?
Feel great.
Good.
Thank you so much.
Excellent. Look how good he looks. Ready for a hamburger.
So we're ready to go. So unless you have any other
No,
questions?
I'm good to go.
Okay.
I want to thank you guys for your
All
time.
right.
How you feel, man?
Well, let's
Feel
get
pretty
you.
good. Actually, got a little pain up top, but just nothing nothing like it was when I first came out. So,
Okay, when you first came out, you had painful.
but they gave me
How
some.
long you been out?
We came out about 1:40.
Well, I'm off to the races. I'm off and enjoying life. Well, I can't say it'll be the life of Riley, but it'll be different than what it's been. So thank you so much. Thank you very much. Appreciate you.
Good luck.
See you guys.
The cases are over. We had a long but very successful day. I think everyone will turn out well. I was very pleased with how things went. Jerome's going to be the most difficult due to the extent of his blackness of his skin and how large he was. The other two are much younger and should do quite well.
We had a good full day and everything went very well. And it's always a pleasure working at this office. I mean, I enjoy all the people I work with. They become my friends, and it's a good experience, and I enjoy it. Every day is good. It's long, but it's very, very good, and it feels very good taking care of the patients.
How's it going?
Hey Doc, I'm doing all right.
Everything went beautiful.
Really?
Yeah.
Oh, thank you. It's
went really
really
nicely.
comfortable right now.
Took us a while, and I was very pleased with how things turned
We
out.
saved the best for last, man.
Oh,
You.
thank you. That's great. That's really good news. And I go over here, and your waiting room is positioned right across the street from your little mini kitchen, or whatever you have here. I see you eating. I see
You know,
all
I
these people
thought
eating.
about that actually. I closed the door because I was
I'm
just
like,
like, that's
man,
kind
what
of
else?
mean. Yeah.
Well, you've just been recovering 10 minutes now. I say you're recovering pretty good.
Thank you.
You are.
Yeah, I feel good. I recognize everybody, and
Yeah.
I feel warm, you know.
But you're doing great. You're very alert.
Good.
You told us some good things while you were going to sleep.
Really?
Remember the joke you said? You told us that when you went to sleep the other time, when they put you to sleep, and they told you to count in reverse by 10.
Yeah, that's what
You know how far you got?
8.
8.
Yeah. We all cracked
The
up.
record is 6.
We laughed.
And you try to fight it. You're like, oh, I can beat this. I could go all the way down to 0. Who do these guys think they are? No, it doesn't work.
10,
Yeah.
9.
See this pretty lady? I wanted to introduce you. I thought I'd match with you. She just seemed like such a nice girl, and I thought you two might hit it off. So, I'm Melissa. This is Kevin. Kevin, Melissa.
How do I look?
You look good.
Huh?
You look alert.
They said I'm pretty alert.
What to do? How do you feel?
Good. A little tired. Getting my bearings together, but
Yeah.
yeah.
You said a few martinis.
Yeah, I was just gonna say. That's right.
Yeah. Do you want to help him? Yeah. And then I'll. Oops, are you in it?
Yeah.
Okay. So you feel okay then, dude? No
Yeah.
nausea? No.
No, I feel fine.
All right, let's go then. I'm gonna take you down in a wheelchair.
Okay.
Okay.
You have everything on the keys.
And well, let's go. Got it all.
Let's go. I can handle this. Yeah, this way.
There's also the possibility the surgery won't turn them out to be exactly the way they want to look. There's cases of surgeons removing too much or too little, and they remove too much, that's a bigger problem to resolve, and they don't look like, there's a lot of people who think they're going to look like Tom Cruise post-surgery, and that's not a realistic chest.
We get to unveil things and see how things look, see if there's any problems, see how things are healing. We're going to pull our drains today. That's sometimes uncomfortable. But the most interesting thing is the patient gets the first chance to look at themselves. Even though things are swollen and black and blue and somewhat painful, it's still a very interesting time. So this is their first follow-up appointments, and we'll see them again in about a week, starting to take out stitches and getting new garments on them. So that's our plan today, is just to get the drains out, get them cleaned up, and show them how they look. Everybody did surprisingly well. I got no calls. I called them all the following day, and they all were doing great. No pain, discomfort. I was very encouraged. No issues, and that's the way I like it, no issues.
Today the guys are coming in, and it's been 2 days after their surgery, so we're all pretty excited to see them. They likely will be coming in walking a little bit on the slow side, probably a little sore because the surgery was pretty aggressive. The exciting part is we take off their garments, their dressings, we clean everything off, take some drains out, and then possibly try on some new vests and get things that are a little more secure, and compression garments, because they still have to be real careful as far as exercise and keeping their activities real low and prevent some swelling and some side effects. This is a very, very simple office visit. The gentleman will come on in and they'll come to the room. It'll take probably 10-15 minutes from the time we start taking off their garments and bandages to the time they'll get another appointment to come back in another possibly 4 to 7 days.